We're in Columbus, Ohio to help celebrate the city's bicentennial. We've just met with some of my friends at the Columbus Zoo and Aquarium, and now we're heading to Ohio State University to check out their state-of-the-art veterinary program. Another thing about Columbus, Ohio is Ohio State University. If not the largest, one of the top 2 or 3 largest universities in the country. And at OSU, it's not just the cancer center there for people. It's a veterinary clinic. It's probably one of the top 5 in the entire country. And it is amazing. When I got to the OSU vet clinic, I met Dr. Bertone, the doctor that works on the orthopedics of the horses. The first thing Dr. Bertone wanted me to see was a unique way in which the OSU Equine Center can evaluate their patients. This horse is like a human treadmill, and they'd put it real slow, and the horse would walk in. Then they increase speed just like we all do when we work out. Can you imagine that?
This horse has arthritis in a hind ankle, not bad, but enough that it was able to enroll in our study. And we're doing a clinical trial looking at a new treatment for osteoarthritis, which is joint pain. She's a racehorse that raced in the state of Ohio. We exercise them 3 times a week to keep their exercise uniform.
You keep her long enough to get her exercise, and then you check her ankle right away or something?
We do. We trot them across a box that measures all the forces that they're putting on that leg.
Oh, I see.
And so we can tell if they're better or worse.
So if this horse takes off, just hold on?
Yep. We're not going to go any faster than a good trot. So you see, Lola can't wait.
I just don't know how you train it.
She sneezed to get clear her nose, you know?
While Lola finished her cool down on the treadmill, Dr. Bertone and I went on ahead to the force plate analysis room, where Lola would be tested to see what progress had been made on her arthritic joints.
And then this area right here is dedicated to the force plate analysis of the gait. So the rug is here to disguise it so that the horse can't see. When the horse's leg lands on it, all of these messages go in electronically underneath here in a cable, and we're going to convert that animal's force into a waveform that we can measure.
Now, when she told me this about the horse, I couldn't figure out what she was talking about. How does a horse step on something and tells you where they have pain? I didn't understand it. So finally, when she showed me, I got an idea. I need to go out there and get on this pad myself. All right, let me do something then.
Yeah,
this
so you're going to do his.
Yeah, you see what's wrong with
Yep.
okay.
So when you walk on that, go ahead and step with your
both feet?
Do your good leg first.
My good leg? Okay.
Yep. Good. Got it? All right.
Can we do it again?
When you come back, do that bad leg.
Okay.
So now we'll show you these curves.
Good, this is cool. Forget the horse.
This is your first curve. This is your good leg. Now you got this one, the blue curve, is the force going downward. That's related to your body weight.
All right.
All right, so here's your bad leg.
Lord.
And your peak was lower than the other leg, meaning you didn't ultimately put as much on it. Yeah, you need to have it looked at, definitely.
This one's the one that I was operating on, and it's fixed. It was, I don't know how much better, and they sure picked up on this thing that this one's about to go. Can you imagine that? That's how they know where to treat the horses. So now we go see a horse do this?
Yes, we are.
All right.
We're going to see Lola.
It's amazing how you've hidden this thing. The horses don't even see that plate, do they?
Yep, and you see how it's kind of got straw and
Yeah,
everything.
yeah,
We let it go and make them think that this is a natural place to be, and they don't get nervous, and they just trot right along. Ultimately, someday, we'll be able to take a stem cell from the horse, put in a gene that makes cartilage, and then put it back into this blood product and inject it into the joint.
Yeah.
Yep, and we're not that far from doing that.
Next, Dr. Bertone took me to the equine operating room, where they use a variety of ingenious techniques to prep the horses for surgery.
So the horse would walk in just like we did, and then we would open these doors.
They took me in the room that was the operating room, actually the room where they anesthetize the horse, and to put the horse down so they could work on the horse's bones and everything, his legs, and it was amazing. But how does a horse, I mean, you just can't tell a horse to get up there and lay down like me.
I'll show you over here. So the horse walks in, and we give it a sedative so that it starts to get a little groggy, and then we walk it over here, and we back it in, and one person can do this. It only takes one person. You back it in.
So I'm the horse going in here
You're
like
the horse,
this.
turn around.
Okay.
And you're facing like this. Put the rope like this. And then they give them the drug that's going to knock them off their feet.
Right.
And that's an intravenous in the vein.
That's here, right here?
Right here.
So the horse goes down and right here.
Like a heap. And when we open the door, they just flop out. and we bring in the hoist. And of course it's plugged in, and these things come down and we hook up to their legs,
Yeah.
and then we pick them up.
Get out of here. Yeah. I had to try it, but I only got a few inches in the air because I'm not strong as my wife. I saw Sue standing over there watching, and I said, Sue, come over here. Because we just had brought our dogs there to be checked, by the way. So I had Sue come over there and play like a horse. Hey, Sue, I didn't do too well. Come over here a minute. Come here. Come here. We're waiting for the dogs. While we're waiting for the dogs, go ahead.
That's
horse.
it.
Okay.
And the horse comes up, and here she goes.
Oh. Now we take her down
We
there?
would take this and we would move her.
Okay.
Push her all the way right there. And you position her, you see how it spins? Yeah. So here we go. And we're gonna lay you down, head in the pad. That's it.
No.
And then we'll often keep the legs suspended like that. And we go in and we clean it up and we take out chips and we get rid of all the frays. We do just like the human doctors. And except our horses are expected to go back and be athletes.
Oh no, I'm just going to walk. Thank you, Sue, for being the horse. And she was a good horse. I mean, she wasn't horsing around. She just was a good looking horse. I have to thank you again. This is amazing.
That's what we do.
so
Oh, you
much.
bet. You're welcome. Thank you.